Hello everyone, today we are going to take a look at another important branch of the external carotid artery, that is the posterior auricular artery. Now again we are back to where we started, the external carotid artery dividing into the superficial temporal and the maxillary artery, and the internal carotid artery and the common carotid artery. This is the basic diagram: superficial temporal, maxillary. And it is from somewhere here that you have the posterior auricular artery. Now you already know that at the point of bifurcation, just a little way along the external carotid artery, you had the ascending pharyngeal artery, one branch. Then somewhere here you had the superior thyroid artery. Somewhere here you had the lingual artery. Somewhere here the facial artery. And somewhere here the occipital artery. So this is a higher one. This is the posterior auricular artery. It's higher than the occipital artery. Now this posterior auricular artery, you can understand that first it's a posterior branch, and second it has to go somewhere near the pinna. Now this posterior auricular artery is difficult to see in any of the routine dissections of the anatomy class. Why? Because you cannot see it in the anterior triangle. Even if you could see it, it could be high up within the digastric triangle and deep behind the posterior belly of the digastric. In fact, it follows the upper margin and the deeper level of the posterior belly of the digastric. So if you had to see this in the anterior triangle, you would have to dissect high up in the digastric fossa, and that too after detaching the posterior belly of the digastric or the anterior belly. Detaching the anterior belly is easier. So if you could detach the anterior belly and the attachment of the common tendon from the hyoid, and if you would shift the digastric entirely, then maybe you could see some part of the posterior auricular artery, this one. Even then it would be a tough job, because in many cases the posterior auricular artery is actually given off inside the parotid gland. So if you draw the parotid gland, we were drawing the parotid gland somewhat like this. So this was our outline of the parotid gland, and you had the parotid duct over here. So you know that the external carotid artery goes into the posteromedial surface of the parotid gland. So the external carotid artery actually has gone up like this, and somewhere here on a deeper plane is the maxillary artery, and on a superficial plane over here is the superficial temporal artery. So the termination of the common external carotid artery is actually deep to the parotid and often within the parotid, and this posterior auricular artery would be given off somewhere here. So the beginnings of the posterior auricular artery would be deep inside the parotid gland, so you could not see this part of it, but where it emerged, there you could see a little bit of it in the digastric triangle. And you would also understand that because this is the tympanic plate and this is the external auditory meatus, so the pinna would be somewhat like this. This would be the pinna, and this posterior auricular artery would be going behind the auricle, that is behind the pinna. So if we again draw the auricle separately over here, and we can say that the posterior auricular artery has gone in this direction. This is the posterior auricular artery, and this is the external carotid artery. So the posterior auricular artery, as it comes out of the external carotid artery and goes behind the auricle. Now this posterior auricular artery ends as auricular branch and occipital branch. So posterior auricular artery ends as auricular branch and occipital branch. Not only that, it gives branch to the sternocleidomastoid, small branches, small muscular branches, and what is main, it gives a stylomastoid branch. Now this stylomastoid branch is actually going deep and behind. So stylomastoid branch, an auricular branch, and an occipital branch. Now this auricular branch, as you can see, is supplying the cranial surface of the auricle. The auricle then has a lateral surface, it has a cranial surface. and the medial or cranial surface is supplied by both the posterior auricular artery as well as the occipital artery, and the lateral surface is supplied by branches of this posterior auricular artery that curl around the lateral margins of the pinna, and they supply the lateral surface also. And from the front, from here, you have the superficial temporal artery. This also gives auricular branches. So the auricle is supplied partly from the front by the superficial temporal artery and partly from behind by the posterior auricular as well as the lower occipital artery, which has auricular branches. Now this occipital branch, the second terminal branch of the posterior auricular artery, it has gone up into the scalp. So when it has gone up into the scalp, in the scalp, you know what the posterior arteries supplying the scalp are both posterior auricular and occipital. So posterior auricular branch going into the scalp, occipital artery termination going up into the scalp, superficial temporal artery going up into the scalp, from the front supraorbital supratrochlear arteries coming up into the scalp. They are all anastomosing in the scalp. That is what makes the scalp so vascular and wounds of the scalp so easy to heal. That is the reason behind it. Now we are left with this sternomastoid branch, and as you know, the sternomastoid branch of the occipital, this sternomastoid branch, the major artery going into the stylomastoid rather, this major artery going into the stylomastoid foramen over here, this stylomastoid artery can arise from either the posterior auricular artery or from the occipital artery. So to draw this stylomastoid foramen, you have got to draw both the styloid process as well as the mastoid process. So if we draw again the skull, you know, if you draw the base of the skull from below, you've got to draw the palate over here, then you have to draw the zygomatic arch, and then you have to go through to the skull, the rest of the skull, and somewhere here you have to draw the foramen magnum. This then is the foramen magnum, and somewhere here is the mastoid process, and this is the petrous part of the temporal bone, and over here you have the styloid process, and between the styloid process and the mastoid process over here you have the stylomastoid foramen. Between the styloid process and the mastoid process, there you have the stylomastoid foramen. It's the same thing on this side also. You have the jagged edge of the petrous part of the temporal, and then you have the rest of this. Over here you have the pterygoid plates, and the central part is basi-occiput plus basi-sphenoid, and through this stylomastoid foramen we are passing this stylomastoid artery. So stylomastoid artery is going into the stylomastoid foramen. Now once it has gone up into the stylomastoid foramen, it is actually going into the facial canal. So if it has gone inside the temporal bone, you see, if this is the temporal bone, so we usually draw the temporal bone somewhat like this. So you have the temporal bone over here and the styloid process. This is the styloid process, and between the styloid process and the mastoid you have the stylomastoid foramen. So the stylomastoid branch of the posterior auricular artery has gone up, and if you actually create a window over here, if you cut out a window from the temporal bone, you can see that deep inside you have the middlear cavity and you have the facial nerve that is actually crossing over the middlear cavity and coming down. So when it is going up through the stylomastoid foramen, this stylomastoid branch of the posterior auricular artery will supply the facial nerve. When it has gone deep into the middlear cavity, it will supply the mucous membrane of the middlear cavity. Not only that, leading back from the middlear cavity you have the mastoid antrum and the mastoid air cells over here. So mastoid antrum and mastoid air cells, they will also be supplied by the stylomastoid branch of the posterior auricular artery in this case, or if it arises from the occipital artery, either way. So To summarize, you have the posterior auricular artery, which is a posterior branch. It is a high up branch, often given up within the parotid gland, and it gives a stylomastoid branch, auricular branch, and an occipital branch. Stylomastoid branch supplying the facial canal and middle ear, auricular branch supplying the cranial surface of the auricle, occipital branch going up into the scalp and anastomosing with the other arteries of the scalp. I think that's enough for this small artery. We will next go into the superficial temporal arteries. Thank you.